It spreads through the air, and most people don't even know they have it. It's ancient, it's deadly. And it's still out there. It travels in silence, hidden in a breath, in a moment. Once feared, now forgotten.
Wow, time to make an appointment. I'm definitely canceling that cruise now. Am I right? Well, at any rate, welcome to the Navy and Marine Corps' Guide to Screening and Managing Latent Tuberculosis Infection, or LTBI. Every new service member undergoes LTBI screening at the time of accession. This includes reviewing previous medical records and any prior TB testing. Checking for test dates, product info, and how the test was administered. If no documentation exists, a new test must be administered. Each year, all active and reserve members complete an annual TB risk assessment using the Navy Medicine 6224/8 form. If a risk is identified, such as recent exposure or high-risk travel, a follow-up evaluation is required. There are only two approved methods for LTBI testing: the tuberculin skin test, or TST, and interferon gamma release assays, known as an IGRA. The TST uses a purified protein derivative. It must be read within 48 to 72 hours. If the member misses the window, the result is marked not read and the test must be repeated. Interferon gamma release assays are blood tests, such as quantiferin or T-spot. These require documenting the date, numerical values, and whether the result was positive, negative, or indeterminate. Only one method should be used: TST or IGRA, not both. Some service members may have received the BCG vaccine in other countries, but remember, prior BCG vaccination does not change how we interpret test results. A positive result depends on risk level. For example, high risk 5 millimeters or more, moderate risk 10 or more, low risk 15 or more. However, 10 millimeter increase over 2 years may also indicate a new infection. Civilian contractors and maritime support personnel working in Navy-controlled spaces must also follow these screening standards. Testing costs are typically covered by the contracting company. Here's a quick breakdown of what we've covered. Complete Navy Medicine Form 6224/8 every year. Use either TST or IGRA, not both. Document everything accurately. Follow up on positives with a medical provider. The moment TB is identified, the medical team must immediately notify the key parties, the local health department, and the Navy Environmental and Preventive Medicine Unit. Navy Environmental and Preventive Medicine Units lead the TB contact investigation with support from command medical staff following CDC guidelines. When it's complete, a report is sent to the member's command, the fleet or type commander surgeon, and the Navy and Marine Corps Public Health Center. If someone is transferring commands during an investigation, their medical record must be updated, and the gaining command must be informed. Now let's talk protection. If someone has infectious TB,
Surprise!
they should be wearing a surgical mask, not a respirator. That mask helps prevent the spread of respiratory droplets to others. Meanwhile, medical personnel working around them need to wear at least an N95 respirator to protect themselves from airborne exposure. Alright, that'll do it for this one. For more information, reference your bibliography on the Navy Cool website. And for further guidance, be sure to reach out to your chain of command.
I-35 with the top down, quick to tell a hater they should get like me. Seem like